So after talking about acute sinusitis and how it is treated and diagnosed and how it presents, let's talk about chronic sinusitis in this section. Chronic sinusitis, when we will talk about this, we will also discuss the pathology of chronic sinusitis, how it develops, how chronic sinusitis present, what are clinical features, how we make the diagnosis of chronic sinusitis, and also what's the surgery performed for the chronic sinusitis. So chronic sinusitis is the sinus infection lasting for months or years is called chronic sinusitis. So as I mentioned, acute is short duration, short term, and chronic is long term. So when it is present for months or years even, this is known as the chronic sinusitis. Pathophysiology of chronic sinusitis is destruction. Now it is present for such a long time, for months and years, and it's infection present. So ultimately that infection begin destruction of the walls and cause osteitis and osteomyelitis, and then those have its impact and its complications also. So first, destruction of normal ciliated epithelium occurs as a result of chronic sinusitis, and this causes impairment of drainage from the sinus. Now what's happening in chronic sinusitis, the ciliary epithelium, cilia are hair-like projections that can cause rid of different foreign bodies, microorganisms, clear the passages. So when that is lost, it causes impairment of the drainage from the sinus, that secretions stay inside the sinus and cause different complications. There is pooling and stagnation of secretions, and this pooling and stagnation can lead to different infections. Mucosal changes, loss of cilia, and edema occurs. And this ultimately can cause polyp formation also. Lot of time patients who visit to the OPDs with chronic sinusitis, chronic rhinitis, they have polyp formation. Polyps are the mucosal growths which hang in the and you can easily see them hanging. So polyps are formed, and this polyp formation is due to mucosal changes which cause secretion collection inside, and as a result of those secretions there is hanging of the mucosal lining leading to the formation of polyps. Polyps can be sessile polyp with no stalk attached to them, and they might be pedunculated polyps which have stalk attached to them. Pathology of chronic sinusitis, again we have different factors can occur and each interlinked with one another and ultimately cause chronic sinusitis. In this diagram, if you see, if there is pollution, chemicals, infection, which are usually which can lead to allergic rhinitis as a result of dust, pollens, and that allergic rhinitis also cause loss of cilia, and loss of cilia can cause impaired drainage, mucosal changes, and infections can occur. And this can also, if there is polyps present or the DNS, deviated nasal septum, adenoids, tumor, allergy, this can also cause impaired drainage and cause changes and infection. If there is allergies, if there is inadequate therapy, so main pathology of the chronic sinusitis is persistent sinusitis, which is not treated adequately. If there is any allergy, if there is any deviated nasal septum, if there are adenoids present, tumors present, and trauma, and there is allergies to the pollens and the different chemicals. So all these are the causative agent that ultimately lead to chronic sinusitis. So the pathology is hypertrophic or atrophic sinusitis. Surface epithelium, there is regeneration or metaplasia. There is infiltration with lymphocytes and plasma cells, and there is microabscess formation, granulation tissue formation, fibrosis, and polyp formation. So mainly the pathophysiology or pathology of chronic sinusitis more or less the same as acute sinusitis, with destruction of mucosa, and there is excess secretion. There is stagnation of that secretion that can cause infection and destruction of the walls, and there is formation of polyps as a result of mucosal edema or the swelling of the mucosal lining. So that's the main pathological process involved. Clinical features and diagnosis. Usually the clinical features are purulent nasal discharge, nasal stuffiness. Now with chronic sinusitis, there is no more serous fluid, which is thin watery type. Now there is purulent discharge, and there is pussy discharge from the nose, and there is more nasal stuffiness because of the retention of the secretion present in the sinuses. Anaerobic infection occurs, and there is anosmia, lack of smelling ability because of the obstruction of the nose. There is local pain, headaches common. Diagnosis is by the X-ray of the involved sinus. X-ray is usually done after the injection. Then we can do CT scans, and the aspiration and irrigation can be done. Secretions are thick, pussy. They should have to be drained, and its irrigation is performed to clean the sinuses, to relieve the condition of the patient. Otherwise, there is bad stuffiness and congestion and pain and tenderness. So these are the different diagnostic CT scan, X-rays, which are done for the diagnosis. Treatment is usually workup for nasal allergies. The causative agent should be removed. The causative factor should be treated to treat the condition. So if there is allergies present, we should work for the removal or control of those allergies. Antibiotics are used, irrigations are done to relieve these symptoms. Decongestant and antihistamines are effective. Endoscopic sinus surgery. This is the endoscope, and the endoscope is performed. Sinus surgery is performed to clear the sinus of any obstruction or discharges. Surgery for chronic sinusitis. We have the chronic maxillary sinusitis. We do the antral puncture and irrigation to open the opening of the maxillary sinus. Antral puncture and irrigation is performed. Intranasal antrostomy, entry into the or the opening in the maxillary sinus or the antrum through the intranasal route. Caldwell-Luke operation is also performed to reach the maxillary sinus. Then for chronic frontal sinusitis, we do intranasal drainage operation and also trephination of frontal sinus. And Haworth or Lynch operation, this is done for the frontal sinus. Osteoplastic flap operation. Then for ethmoid sinusitis, we do intranasal ethmoidectomy, external ethmoidectomy. And for sphenoid, we do the sphenoidotomy. So all these are the different surgical procedures that can be performed to relieve the conditions of chronic sinusitis, because there is persistence of infection and now it becomes very troublesome for the patient. To give some relief to the patient, we have to do some surgical approach to clear the sinuses, to go into the sinuses and clear the secretions and remove the secretions, or to remove the obstructions present in the ostium. So drainage is effective or possible here. This is the surgical approach to access the sinuses. Fungal infections of sinuses. There is a fungal ball infection, which is fungal implantation. Maxillary sinus mainly involved surgical removal is performed. Then there is allergic fungal sinusitis, which is sinonasal polyposis and mucin. Charcot-Leyden crystals and fungal hyphae are present, and there should be endoscopic surgical clearance. Then we have chronic invasive type of sinusitis, which is caused by the sinus mucosa invasion. Opacification is present, granulomatous reaction forms, and there is surgical removal of mucosa and bone. Then we have fulminant fungal sinusitis, which is very common in immunocompromised patients. There is mucor formation, which is rhinocerebral disease. Aspergillus can also call fulminant fungal sinusitis, and there is tissue invasion also. So besides the viral and bacterial infection which mainly cause sinusitis, sinusitis is also caused by the fungal infection, and these are the 4 presentations of fungal infections: fungal ball, allergic fungal sinusitis, chronic invasive sinusitis, and fulminant fungal sinusitis, which is very common in immunocompromised patients, and it's a severe type of fungal involvement known as fulminant fungal sinusitis. And these are the diagrammatic appearances of the fungal infections of the sinuses. Functional endoscopic surgery of sinuses. We have proper drainage and ventilation. Then we have rigid endoscopes. We use elimination and magnification for that rigid. This is the endoscopic surgery of the sinuses is being performed. Then we have microsurgical instruments, precise surgery, and no need for external operation in this case. So this was all about section 3, in which we talked about chronic sinusitis, their presentations, and the treatment and management. Thank you for watching sqadia.com.